Robafen Cf is a combination medication that is used to temporarily treat cough, chest congestion, and stuffy nose symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis and bronchitis. Guaifenesin helps to thin and loosen mucus in the lungs, making it easier to cough up the mucus, while dextromethorphan is a cough suppressant that reduces the urge to cough. This product also contains a decongestant to relieve stuffy nose symptoms. It is important to note that this medication is usually not used for ongoing coughs from smoking, asthma, other long-term breathing problems, or coughs with a lot of mucus, unless directed by your doctor. Cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. It is important to carefully follow all dosage directions to decrease the risk for serious side effects and to avoid giving this product to make a child sleepy. It is also important to consult with your doctor or pharmacist for more details about using this product safely and to inquire about other ways to relieve cough and cold symptoms, such as drinking enough fluids or using a humidifier or saline nose drop/spray. When taking Robafen Cf, it's important to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take the tablet, capsule, or liquid form by mouth with or without food, following the dosing directions on the label or as directed by your doctor. It's important to drink plenty of fluids when using this medication, unless otherwise directed by your doctor, as the fluid will help loosen the mucus in your lungs. This medication can be taken with food if you experience stomach upset. If you are using the liquid form, be sure to use a medication measuring device to carefully measure the prescribed dose. Do not use a household spoon. If your liquid form is a suspension, shake the bottle well before each dose. If you are using sustained-release tablets or capsules, swallow the medication whole. Do not crush or chew the tablets or capsules, as doing so can destroy the long action of the drug and may increase side effects. The dosage of Robafen Cf is based on your age, medical condition, and response to treatment. It's important not to increase your dose or take this medication more often than recommended without your doctor's approval, as improper use, abuse, may result in serious harm. If your condition persists for more than 1 week, gets worse, or occurs with a headache that doesn't go away, a fever, or a rash, it's important to consult your doctor as these may be symptoms of a serious medical problem. If you experience dizziness, headache, nausea, nervousness, or trouble sleeping, you should contact your doctor or pharmacist. Your doctor has determined that the benefits of this medication outweigh the risks of side effects. Most people who use this medication do not experience serious side effects. However, if you notice any mental/mood changes, shaking, weakness, or irregular heartbeat, you should tell your doctor immediately. A serious allergic reaction to this drug is rare, but seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, contact your doctor or pharmacist. There may be additional side effects not listed. If you have any concerns about side effects, you can contact your doctor or pharmacist for advice. Before taking Robafen Cf, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, overactive thyroid, or trouble urinating. Robafen Cf may cause dizziness, and using alcohol or marijuana can make this dizziness worse. It's important to avoid activities that require alertness until you know how this medication affects you. If you are using the liquid form of Robafen Cf, it's important to be aware that it may contain sugar, aspartame, and/or alcohol. If you have specific conditions such as diabetes, alcohol dependence, liver disease, or phenylketonuria, it's important to talk to your doctor or pharmacist about using this product safely. Older adults may be more sensitive to the side effects of Robafen Cf, so it's important to be cautious, especially when it comes to dizziness, difficulty urinating, fast/irregular heartbeat, trouble sleeping, confusion, or mental/mood changes. If you are pregnant, it's important to discuss the risks and benefits of using Robafen Cf with your doctor. The same goes for breastfeeding, as this medication may pass into breast milk. Always consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions with Robafen Cf. Make sure to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Avoid taking certain MAO inhibitors with Robafen Cf., as it may cause a serious and possibly fatal drug interaction. Also, be cautious of taking other products that contain the same ingredients as Robafen Cf. It's important to consult with your pharmacist if you are unsure about the ingredients in any of your medications. Additionally, Robafen Cf. may interfere with certain medical tests, so it's crucial to inform your lab personnel and doctors that you are using this medication. Always follow your doctor's guidance and do not start, stop, or change the dosage of any medicines without their approval. If you or someone you know has taken too much Robafen Cf. And is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can contact your local poison control center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Symptoms of an overdose may include agitation, confusion, hallucinations, and seizures. If your doctor has prescribed Robafen Cf., do not share it with others. It's important to keep all medical and lab appointments while taking this medication. This will ensure that you are receiving the full benefits and that your dosage is appropriate for your condition. The daily dosage and optimal timing for taking Robafen Cf. Will depend on your specific medical needs, so be sure to follow your doctor's instructions carefully. If you are taking Robafen Cf. On a regular schedule and you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Robafen Cf., it's important to keep it at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and do not freeze the liquid forms of this medication. And of course, always keep all medications out of reach of children and pets. When it comes to getting rid of this medication, it's best not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.